PCOD or polycystic ovarian disease or ovarian syndrome as it's called is very common today, especially in younger girls. I think we see about 60% to 70% of young girls undergoing this symptom or syndrome today. So one of the symptoms is thinning of the hair, especially in the frontal area. So we're talking about thinning in this area, and you'll see that your hairline starts going backwards. So you get a bit of thinning here. So the moment you see this, you need to know that you've got to address it right away, because if you can stop the thinning, you can stop the recession and regrow the hair. So the first thing we'll have to do is get a checkup done. It's a hormonal profile to see how your hormone levels are, if there's variations or not. We also do an ultrasound scan to rule out cysts in the ovary. The next thing, we need to treat what's happening at the local level, which is in your hair. So it'll include some tablets which have hair nourishment and nutrition program. It'll also have a hair serum which will have peptides or growth factors to help stimulate the hair growth. Now if there's already a lot of thinning and recession in this area, we will also have to do some treatments like growth factor infusions into the scalp, so that we can deliver growth factors and hair stimulants to grow the hair at the root directly, so that the hair does not thin and you don't get bald spots. It's very controllable and the hair is completely regrowable, but you need to attend to it ASAP. Dandruff is a very common problem. It can be dry dandruff or it could be oily scalp dandruff. So you've got to figure out what's causing the dandruff. Now, if it's dryness, then it's really because the scalp is so dry that it's starting to flake off. So you need to use more of a moisturizing shampoo, and you need to use conditioner. You need to also use warm or hot oil treatment, where you would warm up some oil. It can be coconut oil, gooseberry, olive oil, and then put it onto your scalp only, massage for about 10 minutes, leave it another 10 minutes, so a maximum of 30 minutes, and wash it off. This would be great if you have dry scalp. Also, you could look at vitamin E supplements. That means you just have a propensity to be on the drier side. Now if you're talking about oily related scalp, it could be something called seborrheic dermatitis, so where you get a lot of flakes. But from what you're saying that when you put your hands through your scalp, a lot of the flakes fall off. So that says that it could be clumpy flakes, which are more to do with seborrheic dermatitis. So in times like this, you'll have to use an antifungal product. It's not a fungal infection, but an antifungal will help in this matter. So you get something with ketoconazole. So on the shelf, you get a lot of products. You need to read the label for something saying ketoconazole shampoo, and then you can use this. So you would use this twice a week. First wash would be a regular shampoo. On your second wash, you would use the ketoconazole shampoo only on the scalp, massage it in, leave it on for about 2 to 3 minutes, and then wash it off. This would be the ideal way to do it, and it'll take about 6 to 8 weeks, but the dandruff will come under control. And you're talking about hair fall. When you have hair fall, it really is not just because of dandruff. There's a lot of other underlying causes to it. It can be nutritional, it could be a scalp condition itself, but because you've said that you get a lot of flaking, then it could be related to this. So I suggest that you get your dandruff or the flakiness in your scalp treated, and this will control the hair fall.